they boost your copay? Don't you know what to say?
I started writing this book, and then all this news came out about a week after it was agreed upon that the VA would help with this project and let me in and so forth. And then came this quote-unquote scandal. And so I'd like to begin by looking at the quote-unquote scandal and asking a really important question about the quote-unquote scandal, which is really not asked in the broader media. And then I'd like to look at what is being done and why even the scandal and what is being done about it says a lot about the virtues of a public system. And then I'd like to maybe finish by telling you a little bit about some of the initiatives that are going on and why I think the VA is actually a model for care throughout the country. In fact, I'm not sure we shouldn't have it VA for all instead of Medicare for all, because Medicare is just a payment mechanism. It's not a service delivery model, you know. And it's really tragic that the Republicans have latched on to this quote-unquote scandal and turned it into, you know, the scandal-ridden VA, right? When the American healthcare system is just, in general, almost in every way, shape, or form, the broader scandal, you know, and nobody talks about the scandal-ridden American healthcare system in the papers. And so I think that the reports of the VA as scandal-ridden, dysfunctional, are highly exaggerated and really serve a very particular political agenda, which is to discredit any alternative to market-driven, for-profit, fee-for-service, you know, let's make money out of sick people, healthcare, which I believe one Republican senator or congressman described the so-called scandal as a godsend, you know, for people who want to discredit any kind of initiative. And anybody who wants to see the hypocrisy of Republicans on this issue, I mean, some Democrats should check out Bernie Sanders' website. And there's video clips of Republican senators and congressmen who refused who killed the bill that Sanders introduced in February to give more funding to the VA, which would have helped with some of these problems, although not all of them. And really, the hypocrisy is just stunning with these guys coming up there. I can't remember one of their names, but saying, you know, our veterans wouldn't want us to pass this bill and give more funding to the VA, you know, if they knew that this was going to bankrupt America in the future. I mean, it's just extraordinary, like how they justify not, you know, giving this pittance of money. I can't remember if it was 21 billion or something like that. I mean, pittance to veterans and to the VA system. So, okay, let's look at the two big problems that are being focused on now. So one is wait times, and you know, this is serious, and a number of veterans, particularly in the South and the Sun Belt, were unable to get care in the time that was deemed to be realistic and the time that was deemed to be appropriate by managers in the VA, and that was 14 days. And they initiated what's called P4P, pay for performance, which is a technique that's been used in the private sector to link physician, nurse, whatever, performance to, and bonuses to performance measures. Now, it's one thing to have performance measures that are realistic and link performance to that. But if you were to ask me, if you were to link my payment to something that's completely unrealistic, then I'm not going to perform and pay for performance in systems that have scarce realistic resources, unrealistic performance measures, and so forth, lead to what is called the normalization of deviance, which is a concept that was developed by a woman named Diane Vaughan when she analyzed the Challenger space launch decision and the culture in NASA and the other companies that work with NASA. And when you have a certain brew of conditions in an organizational culture, including unrealistic performance measures and bonuses attached to them, it's almost inevitable that you get this kind of normalization of deviance and cheating, you know. Now, the performance measure of 14 days for a primary care appointment, when you first call, or any kind of appointment when you call a physician, depends on certain conditions. There are only 24 hours in a day. A doctor, a nurse practitioner, physician assistant has to go to sleep, eat, go to the bathroom, answer phone calls, etc. So there have to be enough primary care providers, they call them, which includes physicians, nurse practitioners, and physician assistants, in your system in order to accommodate the people who are calling up wanting appointments. Most countries with single payer, or not single payer, because that's a bad word in my view, but anyway, we won't go there. Most countries with national health systems of some sort, whether they're multi-payer like the Dutch and the French and the Germans, or like the National Health System of Scandinavia, most other countries with some sort of nationally funded tax-supported program have a split of specialists to primary care physicians that is 50-50 or sometimes even 60-40. In the United States, we are a huge outlier, and we are producing in medical training programs only about 15 to 20% of primary care physicians. And because of that problem, because, you know, do the math. I mean, 765,000, I should have done the math for this, but I didn't. You have 765,000 doctors. You have 20% of those that are primary care physicians. That's what, 140, 150,000 physicians. And that includes pediatricians. And you have 330 million people in this country. I mean, do the math. You know what I mean? And now for many primary care physicians, they have patient panels. A panel is the number of patients that someone is responsible, not how many patients they may see. Because you may see some of those patients, you may never see many of those patients, you may see some of them on a weekly basis. Many primary care physicians in this country have patient panels of like 3,000 people. There are people at UCSF who sleep in their offices, right? Because there's too many people chasing too few, quote unquote, providers. We've added to those nurse practitioners, but not enough. We've added to those physician assistants, but not enough. And many of those nurse practitioners and physician's assistants, when they leave school with their, you know, $100,000 in debt or $150,000 in debt, whatever, they have as much debt as physicians, maybe slightly less because it's 3 years instead of 4 years. 7 years instead of 8 years. They are being snapped up by doc in the boxes like Walmart and Walgreens and CVS, right, who pay about $30,000 to $40,000 more than the VA. So there's a real problem with the number of people available to see, the supply of people available to see patients. So there's about 400 positions vacant in the VA for primary care physicians. They can't be filled, not because of salary problems, but because the VA depends the VA depends on the supply produced by the broader healthcare system, educational training programs, educational programs for physicians, nurse practitioners, etc. The VA does not have its own system of medical schools. The VA does not have its own system of nurse practitioner and physician assistant schools. It's dependent on what we produce. We aren't producing enough of those people to accommodate the needs of either the general public or veterans. So veterans, the average wait, I think there's what was the problem? So the problem was that they said you should only have to wait for 14 days. I mean, I don't know if you've tried to get a primary care physician appointment in the private sector. If you've tried to get a dermatologist appointment, endocrinologist appointment, or orthopedic appointment, you can't call them up and, get in tomorrow, right? Because, there's not enough of them. And in many primary care physicians have closed their doors to new patients because they're so overwhelmed. You are lucky if you can get into a practice. And remember, we've just added 8 to 9 million new people into the mix with the Affordable Care Act. At the VA, the problem started in Phoenix. They had an influx of 80,000 vets, right, in the Sun Belt because the Army and the volunteer Army has tended to recruit a lot from the rural South and West and so forth, and B, because a lot of vets are retiring to the Sun Belt. So there's 80,000 people coming in, and there's no increase in the number of primary care providers that were available to see these people. So, you call up for an appointment, and you can't get in, and your pay performance encourages, and some people cheated. Bad, but, is the problem is the performance measure was unrealistic, if not ridiculous. And again, if you compare it to the outside world, the average wait in Los Angeles, I believe, for a primary care provider appointment is something like 60 days. I mean, the average is something like 50 to 60 days for those of us seeking an appointment. This is a real problem, right? I mean, as you get older, it gets even worse because you should be going with geriatrician, not just a PC, a regular family physician, and there's hardly any of those. And we're all in this room looking like we're kind of in need of that, and it's tough to find. And actually, the VA has some really, really interesting programs that focus on geriatrics that I'm going to tell you in a minute. So, it turns out that an audit done by the investigators found that 57,436 veterans, which was 1% of appointments, couldn't be seen in 90 days. Well, that's not good, but it was like 1%, right? And it's hardly, a crumbling system that the media has depicted. The other problem, and really, I don't think there have been any deaths that have been attributed to this, although I'm sure they will find out and report them. And one of the things that is interesting about a public system is that these things do become transparent and reported and action taken, action is taken around them. Because the VA is a public system. When I did some consulting for the VA some years ago, one of the things that really impressed me about the VA was that providers and staff were very cognizant of the fact that if Johnny didn't get his PT appointments, when he came back from Iraq as a complete basket case, mommy and daddy call their congressman, and somebody has a congressional investigation if Johnny doesn't get his PT appointment in the private sector, good luck, right? I mean, there's just scandal after scandal after scandal in the private sector in American healthcare, not to mention the scandal of more than 20 governors not accepting Medicaid expansion and permanently shutting people out of any, I mean, you talk about wait times, you're essentially online forever. But the VA is a system where usually these things get revealed and reported. It's hard for me to imagine a private sector hospital tolerating a number of employees, physician employees, writing articles in the New England Journal of Medicine and JAMA, criticizing their institution and not being fired in like 10 seconds. And yet, following this revelation about the problems in the VA, there were numerous commentaries in some of the nation's most prestigious medical journals by employees of the VA talking about the problems, talking about how to fix the problems, etc. Now, the second issue is the issue of managerial, the culture that the media has deemed hostile to whistleblowers. So the implication in the coverage is that in the private sector, because we have to contextualize this whole discussion is occurring in the context of the government can do no right and the private sector can do no wrong. So everything that comes out about the VA goes into this kind of Vitamixer or wearing blender of anti-government sentiment in the US. And the implication is always, I think, that somehow the private sector has no wait times. I mean, this is a huge myth in America, and is used against a lot of single-payer and national health care reformers, because this notion that, oh, you're going to wait forever in Canada or the UK or Scandinavia or Holland or wherever, and in the US there's no wait times. I mean, this is like a joke. I called my PCP once, and I actually had appendicitis, which I didn't know. It was an odd symptoms, and I call up their office, but excellent insurance coverage, wonderful doc, and basically it was October, and the gatekeeper said I could come in February, and I had a friend whose daughter had diabetes and was being managed by her family care practitioner poorly, and she needed an endocrinologist in New York City, and called somebody's office. This was, I can't remember, I think it was November or December, and was told she could get an appointment in March. And I am fairly well connected, and I had to call some friend who was the dean of something at Cornell Medical School and say, can you help? And he got her in a month. So this was, the good thing was a month, the worst thing was 4 months. And it just so happened that we could get her in for in a month because I was well connected, right? So if you're well connected, maybe you could get in. But the point is, there's a lot of people with diabetes and not that many endocrinologists, and 24 hours in a day, and and an aging population, and a society that's producing more and more chronic illness, and we may even need many more doctors and nurses and so forth that we have if we're going to continue doing all this stuff to people. Well, the managerial culture is being deemed corrosive, says the New York Times, dysfunctional culture that is hostile to whistleblowers, as if somehow there were some culture somewhere that were friendly to whistleblowers. Now, we have to think about this. A culture that is friendly to whistleblowers is an oxymoron. A whistleblower is, by definition, someone who reveals something that their organization doesn't want revealed. Otherwise, they would be called problem solvers. So there is no culture outside the government or inside the government that is friendly to whistleblowers. You aren't a whistleblower if people are friendly to you. You are a person who goes to management or whoever is in charge and says, Joe, we have a problem, and Joe says, oh, Jane, thank you so much for revealing this problem, let's work together to solve it. Then you aren't a whistleblower, right? Now, we need cultures like that in healthcare, but we don't have them in the VA, it seems, or anywhere else. And if you look at, I've spent 30 years looking at healthcare management, an itsy-bitsy portion of that, the VA. And I think the VA does have problems with its management style, but it's only because VA managers reflect the broader way that management functions in this society and many others, which is command and control, discipline and punish, shut you up, etc., etc. It has been said that managers in the VA have threatened people who try to reveal serious system problems. I'm sure that's true. I don't doubt it. But if you think it's any better out there, think again. I know many nurses and physicians and social workers and so forth who are shaking in their boots about raising serious patient safety issues to management. Many managers will say, oh, we have an open door policy. You walk through the door and you see a sign on the wall saying, no whining zone, right? So, wait a minute, am I whining or am I identifying an issue, a serious issue? Managers, chief nurses in America's hospital, if there's a union drive and the union wins, they get fired. Because, the idea of your performance as a manager is, pay for performance is linked to how few complaints, how few problems, how little unhappiness is raised. Now, you can't engage in a complex endeavor like healthcare without having mucho problems involved in this, because it's so complex. And in hospitals all over America, nurses, doctors, housekeepers there's a way that you raise problems. It's called an incident report. You file an incident report. These reports are sadly all too often used to punish people, not to encourage institutional learning. And managerial performance is often linked to how few incident reports are filed. It's crucial to encourage people to file incident reports, because that's how we learn from mistakes. You don't want there to be, it's not possible for there to be no incident reports. I mean, that would suggest, it's just not realistic. So there's been case after case after case of people who've been fired, who've been disciplined, who've been etc., because they've raised crucial issues. Several years ago in 2009, 2 nurses from West Texas, from Winkler Memorial Hospital, were not merely fired, but criminally prosecuted for misuse of official information because they anonymously reported to the Texas Board of Medicine a physician who was engaged in really scuzzy, unsafe practices, and they were it was extraordinary. That sends a message out, to everybody in healthcare, which is shut up. So managerial lack of support. I mean, there's been study after study. 25% of nurses in New Jersey responded to a survey about how they felt about their conditions in their hospitals, and 42% of those said that their nurse managers were unsupported and would not support them in a dispute with a higher-up like a physician, even if the nurse was right. I mean, I could go on and on about this. So again, compared to what? The problems in the VA need to be addressed, but however, how the VA solves them needs to be looked at as an example for how things can be solved in a broader healthcare system. I just want to end with saying that I'm just deeply impressed with the care the VA has. Once you get in, and there's all kinds of obstacles that Congress has set, to people getting in because of the lack of funding. The VA now serves about 9 million people. Many of these vets have serious problems. Is anybody here a physician or a nurse? All right, okay, so these are problems that a lot, nurses, doctors, which?
Nurse.
What?
RN.
Okay.
Nurse practitioner. Nurse practitioner.
Okay, these are problems, I mean, these vets have, your average, a routine Vietnam vet might have substance abuse, homelessness, PTSD, asthma, obesity, COPD, chronic obstructive pulmonary disease. I mean, you name it. And the average, a routine vet coming back from Iraq or Afghanistan could have traumatic brain injury, PTSD, double amputations, I mean, it's just like a joke that the private sector could deal with these kind of people or would want to. I mean, we do horribly with mental health care in the private sector, and many vets have serious mental health problems. In fact, that's kind of characteristic. I mean, war is like a really bad idea, and when you go to the VA, you see how bad an idea it is. Because if you live, you are not a happy camper a lot of times, right? And the VA is actually equipped to deal with these problems. The VA has once you're in, the VA has amazing mental health programs. I mean, amazing PTSD programs that are models for mental health for people who deal with these issues outside of the VA, the National Center for PTSD, and there's no limit to the amount of mental health sessions you can get in the VA, unlike the private sector. Physical therapy. You now can get, you go to your physical therapist now, your knee, because your thigh bone is connected to your hip bone, is connected to your ankle bone. You don't usually just have like one physical, you may have bad back and your hip, and I personally have shoulder problems, back problems, hip problems, and feet problems. Just, when you go to a PT in the private sector, you get to have one problem, right? Pick your problem. In the VA, you can have a lot of problems, right? Because that's what you got. Durable medical equipment. You guys who are nurses know that, under Medicare and private insurance, you can usually get one, you can get a walker or a wheelchair or this or that, one per year, whatever. The VA, you need a walker, you need a wheelchair, we'll give you both. Now, the VA also coordinates care because it's a system, and if anybody wants to, until my book is out, read Best Care Anywhere. This is should be required reading for people in single payer movement because it actually explains why you need a system and why our non-system doesn't work. And the reason why the VA works and has managed to contain costs and give high quality care is because once you're in, they're kind of responsible for you forever. So right now, for example, the VA has an amazing program about dealing with what's called polypharmacy, which is giving people too many meds. You guys are nurses, I mean, people leave like dementia, it's just take everybody off all the meds, right? Just throw them all out, right? And the VA is launching a big initiative across its 152 hospitals and then they have over 1,700 facilities everywhere. They're launching an incredible initiative to deal with delusion in hospitalized patients, to deal with the acute care of the elderly. They have ACE, what's called ACE rounds, to deal with the problem of prescription drugs in the elderly, which is because they don't study drugs in the elderly, they study in young people, and some drugs are not good. And the VA, because it's responsible for you, you know, the veteran, over many, many years does preventive stuff, can spend money on stuff. They may even give you more expensive drugs rather than less expensive drugs. And if you look at the private sector, I mean, probably Kaiser is the next best thing. Kaiser has a terrible record on mental health, which has just been revealed by the National Union of Healthcare Workers. And Kaiser is limited because people leave Kaiser because it's not a national system. My kids just enrolled in Kaiser under the ACA, and they were here for 3 months. Now they're going to Massachusetts. They'd love to continue Kaiser, but there's no Kaiser in Massachusetts. So why, it makes no rational economic sense for Kaiser or any other insurance company to spend a lot of money educating my kids, or you, or me, or anybody, doing preventive work on someone when that return on investment is going to come in 20 years, and it's not likely that those people will be in that health plan. Now, these health plans could kind of get some brains and think, well, you know, since everybody's going to be in some kind of health plan, or many people, it would pay for all of us to do prevention, but they don't have many brains and they can't see past the quarterly profit statement. I could go on and on about what I've seen at the VA. I think the VA is a huge system. It has 230,000 employees. It has a lot of extremely complex cases. We can't deal with the people that we have in the private sector. Imagine laying off 230,000 employees who are, by the way, deeply committed to these veterans, and absorbing 9 million people with these really complex problems that you know, most healthcare professionals simply can't deal with. I mean, it's insanity, you know, but of course we live in crazy times. I think the VA, people in single payer, should embrace the VA, should learn about the VA, and we really have to offer a counter narrative to this scandal-ridden VA narrative that is being put out now, you know, that too many people are buying. It's very pernicious. So basically, I'm so sorry to say I have to leave in 10 minutes or 15 minutes. I'd love to answer questions. I hope you will continue to investigate this. I've written a couple of articles. I'm writing more. As I said, Phil Longman's book is wonderful. I brought this PNHP statistics. And, you know, I just think we have to do our best to really talk about our version of what a healthcare system should really look like. And this is actually one that's right here in the US. And I just have to say in closing that when I go there, and I've been all around the country, I sort of invariably leave thinking, no wonder they hate it. I mean, this is a you know, it's a disaster for Republicans, the VA, because it's really a great system, right? It's a government-run system that provides amazing care, and that's really bad for people who are market addicts, profit addicts, market addicts, and who believe that you know, you should profit from the care of the sick. Not just profit, you should make a killing, right, from the care of the sick. I mean, it's one thing to make a living, it's another to make a killing, you know. So,